We also have from the Alameda County Social Service Agency, Cerise Grice.
Yes. Hi.
Welcome.
Thank you. Good afternoon, Chairman Thurman and committee members. On behalf of the Alameda County Social Services Director, Lori Cox, I'd like to thank you for giving me the opportunity today to speak to you. My name, again, is Cerise, and I am a master trainer for a curriculum called Making Proud Choices. I'm also a management analyst in the county, and I'm here today to talk to you about supporting an investment proposal of $10 million for reproductive sexual health education for foster youth. You will hear later from John Burton Foundation, and they will talk to you about our support as well as CDSS's support to have this kind of project operate across the state. Although there is a current 2015 analysis from the New England Journal of Medicine that found that the rate of unplanned pregnancy in the United States has reached a 30-year low, including among teens and young teens, pregnancy among youth in foster care remains alarmingly high. A 2014 study by Cal Youth the Professor Mark Courtney did this study, found that 26% of 17-year-olds in foster care in California had been pregnant at least once. That's a rate that's over 10 times higher than that for non-foster youth between the ages of 15 and 19 in California. By age 21, over 35% of young women who were in foster care at age 18 will have given birth at least once. This high rate of pregnancy has serious implications for foster youth, whose likelihood of lifelong economic stability is significantly diminished by a teen birth, as well as for their children, who oftentimes experience high rates of child maltreatment and have a disproportionate number of substantiated reports of abuse against them before the age of 5. It also has important implications for the child welfare system itself, which is legally and financially responsible for the high-risk, often resource-intensive cases of parenting dependence. Given the seriousness of these issues, Alameda County chose to take action to reduce the rate of pregnancy among youth in foster care. In 2012, Alameda County and 4 other states were awarded the opportunity to participate in an 18-month institute to learn about an evidence-based curriculum called Making Proud Choices. I had the privilege of being a part of that team from Alameda County. And we engaged in an 18-month planning process to integrate the delivery of this curriculum into the child welfare system. We began offering Making Proud Choices classes in February of 2013 to foster youth and to probation youth between the ages of 14 and 19. There are 636 foster youth in child welfare presently, and there are 450 non-minor dependents. These are youth that are ages 18 to 21 that are currently in child welfare. In addition, there are 298 probation youth between the ages of 11 and 17 in their system. Our trainings are held in a variety of places. We have 2 independent living skills programs in the county, one in the north part of the county and one in the south part. We also offer it in our Juvenile Justice Center and in our Camp Sweeney probation program. We have 2 kinship centers that provide the program, a number of group homes, a treatment center called Thunder Road. We have just recently secured a pregnant and parenting program through the Office of Education, and we are seeking other youth-serving organizations. Youth Radio has been a part of our training program, as well as Youth Uprising, and we're adding more. To date, we've trained over 300 youth in out-of-home care on this curriculum. Our training includes a number of things. It's 10 modules, meaning 10 sessions of 1 hour and 15 minutes. We offer a pre and a post survey. We offer incentives to the youth, refreshments, because they love those, as well as games that we play, and prizes are given during those games. There are materials. We also provide contraception, condoms, both female and male condoms, and dental dams and lube and other kinds of things that youth learn about in the program. And for them, what they most enjoy is the $50 gift card that they receive at the end of the training. We've done this through the volunteer assistance of co-facilitators that we have begged many youth-serving organizations to participate with us on, and they have been committed in delivering this training with us. Presently, we have 20 facilitators who train in the host of locations that I've mentioned. So what has this told us? Well, we have some survey data that we can share. Youth come into our program learning that what they understand about safe sex and abstinence is incorrect. What they learn leaving that program is what they need to know to practice safe sex or to be able to communicate with their partner that they do not want to have sex at this time. They've learned how to prevent unplanned pregnancy and sexually transmitted infections. They feel confident in having role-played how to practice that communication with their partner, and they've learned how to practice safe sex if they choose to engage in that. They've shared with us that those who have been sexually involved or had sexual activity started at the tender age of 12. Youth have also agreed to talk to a trusted adult about their sexual health needs, and they have admitted in the private survey that many of them have been pregnant more than once before the age of 16. So today, unfortunately, there is no funding for this project. Our department has solicited private donations to pay for what you've heard, and we continue to be committed to that effort. But I am pleased to say that John Burton and others are in support of the state looking at this evidence-based curriculum and supporting it financially. Without your support, it will be limited in what is done across the state. So we ask that $10 million be put into the budget so that the state can then do an opt-in program and offer counties the opportunity to take on this practice that I run and many others that are best practice. Finally, it would ensure youth that have access to age-appropriate sexual and reproductive health and screening that's recommended by the American Academy of Pediatrics. Thank you.
Thank you, Ms. Grice. Ms. Lemley from the John Burton Foundation will be adding further testimony. Maybe Mr. Mecca will make some space. He testifies here every week. I think he can. Would you, sir? Thank you so much for your.
I'm old enough to have once had Ms. Lemley as an intern.
It all comes around.
Welcome.
Well, thank you very much, Mr. Chair and members of the committee. We appreciate this time. My name is Amy Lemley. I'm the Policy Director of the John Burton Foundation, and I'm here to speak in support of a $5 million budget proposal to reduce homelessness among former foster youth. As we are all aware, California is in the midst of a housing crisis. According to a 2015 report by the California Legislative Analyst's Office, California's housing prices are the highest in the nation, with the average rent for a two-bedroom apartment in California being a full 48% higher than the U.S. average. While this conversation seems to dominate the headlines every day, it rarely focuses on the most vulnerable, including youth who are exiting from foster care, who face the same rental housing market as the rest of us, but with less education, less income, and less social support. The current budget proposal is an effort to address the housing crisis experienced by former foster youth by modifying the eligibility criteria for the Transitional Housing Placement Plus program, known as THP Plus. Currently, youth are eligible for this program if they were in foster care on or after their 18th birthday. Under the proposal, youth would be eligible if they were in foster care on or after age 16, so 2 years earlier. This program was established in 2001 and last year served 1,696 foster youth. Evaluations have shown the program consistently increases the rate of employment among youth in foster care and their income. Most importantly, 86% of youth who participate in the program exit to safe, stable housing. While the program has been successful, it has left behind this small but vulnerable group of young people, those who were in foster care on or after age 16, but not at age 18. These are youth who exited to adoption, reunification, or guardianship after age 16 and are not eligible for THP+. While these young people have achieved legal permanence in the eyes of the child welfare system, their needs are far from met, as demonstrated by a 2014 study. As a group, they experience poor physical health and mental health, and over 1 in 4 read below a 6th grade level. 40% have considered suicide, and a full 24% have actually attempted it. These challenges do not disappear when they achieve the legal definition of permanence. They are still very much at risk and very much in need of support. Other programs in California recognize this and set their eligibility for youth who are in foster care at age 16, including the Independent Living Skills Program, the Chafee Education and Training Voucher, and the Cooperating Agencies Foster Youth Education Services Program in our community college system. With access to THP+, these young people can receive access to high-quality housing combined with the much-needed supportive services. The housing crisis in California is complex, and it will not be solved overnight or with a single policy approach. Modifying the THP+ eligibility to serve these youth who are in foster care at age 16 is one practical strategy to improve housing affordability for former foster youth in California. Thank you very much.
Thank you, Ms. Lumley. Just one question. This committee last year made several recommendations to expand THP Plus funding. I was curious about the circumstances of this proposal that you've offered, that you said that youth who leave care at 16, what are the circumstances under which that young person then needs a THP Plus program later? Like if they left for reunification or another circumstance, what is it that causes them to have the continued need?
Well, often, as we've heard, this is all in the context of really CCR. Young people can be reunified with their biological family. Our administrative assistant at the John Burton Foundation is exactly that case. She was reunified, and we are very supportive of that, but she was reunified to a family in poverty who quickly became homeless. And because she was reunified after age 16, she wasn't eligible for THP Plus, and so she had almost an identical foster care experience, but because she achieved legal permanence, she was not able to participate in that program and would have benefited for it tremendously. So I think whether it's being adopted, being reunified, or exiting to guardianship, all of those individuals don't have a magic ticket to stable housing for the rest of their lives. And I think when we look at who's in care at age 16 as a proxy for a very high level of risk, there's a strong case to be made to keeping that door open for this transitional housing program.
Thank you for the clarification. I think a lot of people make assumptions that if a young person leaves care, that they no longer need assistance. And so I appreciate you giving the emphasis that you have. And just want to say that this committee has either supported or expressed support for so far all the proposals that we've heard in some way, shape, or form, from Chafee to supporting pregnant and parenting teens and how we help on the preventative side, and of course dealing with the issues of homelessness. And so we do appreciate all that you all are raising. Stand by. We want to, in a moment, we'll have public comment and people can speak on any of the proposals, but we do have a few more proposals that we want to invite others to come forward. Thank you to all of you who presented so far. Mike Range from the Public Health Nurse Department at Alameda County Department of Public Health.
And actually, my name is Brenda Parrish, and I'm actually here speaking in place of Mike.
Well, we're glad to have you. You tell Mike that we said we're glad to have you. And no offense, Mike, but he's not here, and you are. So thank you for being here. Oh, he is here.
He's actually in the back.
Mike said that he's a team player, and without the team, there is no dream. Thank you, Mike. We appreciate you. We appreciate you. Thank you for waving. Let's give him a round of applause. Let's give Mike a round of applause. We don't usually do applause in here, but I think I need it, so thank you. Thank you. Gail Johnson Vaughn from Families Now. And then we'll have reaction from the Department of Social Service. We'll hear from the LAO and public comment. Whenever you're ready.
All right, Mr. Chairman and committee members. My name is Brenda Parrish, and I'm a foster care public health nurse with Alameda County Children and Family Services in their health care program for children in foster care. And I'm actually here on behalf of the other public health nurses in the state to request some funding, not additional funding, funding for SB 319 and 238 that were passed last year to provide for oversight and monitoring of psychotropic medications for children in foster care. You know, the public health nurses in foster care, we have the distinct privilege of supporting the healthcare needs of children and youth in foster care. And we also assist the non-dependent minors to make informed decisions about their healthcare needs. But as much as our hearts and commitments are in our work, we have a deep concern that currently not providing the high level of care, that we're not able to provide the high level of care that we prefer. Specifically, the roughly 2/3 of foster children on psychotropic medications don't receive basic medical monitoring. They don't get the follow-up visits, and they don't always receive necessary labs. And this equates to nearly 25% of children ages 6 to 18 in foster homes and 56% of children in group homes. And when comprehensive medical monitoring does not occur for our children in foster care who are administered psychotropic medications, this dangerously escalates into overmedication with frequent changes in placement, increased side effects of memory loss, morbid obesity, diabetes, heart disease, developmental delays, irreversible tremors, and exacerbation of existing mental instabilities, all of which has resulted in long-term disabilities and in some instances premature death. And if we can catch these adverse health effects early, oftentimes the ill effects can be reversed. And this is tertiary prevention. And we can't allow ourselves to be desensitized. We know that adverse childhood experiences negatively impacts children and youth's health and well-being into adulthood. And we have to fully understand the complexities here. You know, in one case, we have a 3-year-old who has a diagnosis of oppositional defiant disorder. And I don't know about you, but my 3-year-old was very oppositional at age 3. And, you know, we have, you know, a 10-year-old that's on multiple antipsychotics to control his behavior. And we were able to advocate for him to get an assessment so that they were able to actually stop all of the medications for him. You know, last year with the passing of SB 319 and SB 238, this gap in services was identified, but the need needs to be filled with additional staffing. With an average caseload of 270 cases, current foster care public health nurses cannot provide the level of care that is needed to improve health outcomes for our foster children and youth. And this is our ask today. We urge you to appropriate the specified level of funding for additional foster care public health nurses to specifically provide this more comprehensive coordination of care that our children in foster care urgently need and deserve to manage psychotropic medication prescriptions. What we don't do for our children will have unfortunate consequences that are preventable. Thank you.
Thank you very much for that. And I just want to add, last year when we were moving forward a package of bills through the legislature around psychotropic medication when it comes to the foster care system, I was happy to help jockey that on our side because this issue is so incredibly important, and the statistics and data and the stories that you've shared are terrible. So with that, I'd like to ask for reactions from DSS and Department of Finance. I'm sorry? Oh, I'm sorry. Sorry about that. This is what happens when we have so many members going back and forth. I'd like to turn it over now to Gail Johnson-Vaughn from Families Now.
Thank you, Committee Member Chu. I'm Gail Johnson-Vaughn, founder and director emeritus of Families Now, and representing the California children waiting in foster care for permanent families. Since 1998, California's actually reduced the number of kids in care by 46%. But at the same time, the number of children who are turning 18 or 21 leaving without families has remained constant at about 4,000 the whole time. We used to think that achieving permanency for these children, older children, teens, and minor dependents was impossible. But best practices, many of them developed and perfected here in California, have shown that they're not only possible but probable if you use child-centered specialized permanency services. These same proven services have documented cost-saving effectiveness of the child-centered specialized permanency services, generating savings in excess of the cost of providing the services, often in the very same budget year. Despite their proven success, these services are rarely used in our state, causing hardship and grim outcomes for the children in our care. 50% within 2 years, homeless, victimized, imprisoned, or dead, and unnecessarily high foster care costs at all government levels. The elements of these child-centered specialized permanency services are built into our continuum of care reform and are the key to the success of CCR. Counties and their nonprofit partners have shown eagerness to build capacity to be able to provide these services in order to improve permanency outcome for the children in their care. Given that continuum of care goes into effect January 1st, there is no time to be lost. Unfortunately, few California counties have the understanding necessary to successfully initiate these proven practices, and training and technical assistance must be provided as quickly as possible. This budget item engages key public and private child welfare and mental health stakeholders and provides a series of regional introductory trainings and orientations in year 1, 16-17, and builds a cohort of implementation pilot counties using a shared learning model to implement specialized permanency services in the next 4 years. We're in conversation with CDSS about this proposal so that we can identify any issues that they may have, and those can be clarified. If we are serious about moving our children out of expensive foster care, we must give our counties and their partners the tools they need to not only step down the children into less expensive foster placements, but into safe and committed permanent families. We would want nothing else for our own children. And in fact, as legislators, you hold the parental responsibility for the children who we've moved. I urge you to approve this budget proposal.
Thank you, and very much appreciate that presentation. Now, if I could ask DSS and Department of Finance if you have initial reactions to these various proposals.
Thank you, Mr. Chu. Will Lightbourne, Department of Social Services. First, you see the wonderful partners we work with. There is nothing you've heard today that is not absolutely appealing, and we fully expect to certainly work in terms of providing technical assistance to all of the proposals. At the same time, this is a budgeting process, and between the legislature and priority setting and the administration, we'll have to see where we get to. But again, I feel so privileged to work with the people you saw.
So you're saying if it were up to you, you'd fund them all.
Yeah, hey.
Thank you, Mr. Lightbourne. Great answer. Department of Finance.
This is Chi Lee from the Department of Finance. Just want to reiterate that we don't have a specific comment, and we are reviewing, and to encourage the advocacy proposals for the people who are thinking out how these proposals and what needs to be done, to also reach out to the Department of Finance for technical assistance, given how 2011 realignment has changed many of the child welfare services programs and how they are funded. We would like to clarify many of the implications that could arise, so that going forward we wouldn't have such problems that we can avoid.
Thank you very much. And now to the LAO.
Thank you. Jenny Bella with the Legislative Analyst's Office. We're continuing to learn about each of these proposals and meet with the respective representatives. We have no official position at this time, but would just like to offer ourselves up also as any technical assistance as you're starting to weigh through each of these and think about your own priorities. We're here to help and provide any assistance we can.
Thank you, Ms. Bella. And with that, I want to turn to public comment.
Hello, my name is Tisha Ortiz. I'm a former foster youth and youth advocate at the National Center for Youth Law. I was over-medicated in foster care, taking 12 pills a day. I had a lot of side effects from these pills, major weight gain, and I developed a heart problem. If it weren't for the public health nurse listening to the side effects I was having, I would not be here today because my heart was the problem with these medications. So please support the budget for the public health nurses. Thank you.
Next speaker.
Hi, I'm Shaniqua Arrington, and I'm a former foster youth and youth advocate. And I've been on a lot of medications with a lot of side effects. And I've had a lot of health problems with medication. And I know that it would have probably been helpful if I had someone there to help monitor my medicines. So I hope that you support the bill with the public health nurses in the budget. Thank you.
Thank you. Next speaker.
Hi, Tia Orr on behalf of the Service Employees International Union. A couple of measures that were here that we're in support of, specifically the CSEC proposal we are in strong support of for social workers, as well as the PHNs, and THP Plus is also a proposal that we're in strong support of. Specifically, I wanted to voice, we have workers here, public health nurses here that have come across the state to come talk to you today about their work and about our need and support for the funding augmentation for public health nurses on the ground. I would say in the psychotropic meds in general, not only do we need to provide attention to the public health nurses who need funding for additional workers and staffing, but also the child welfare service social workers who are also going to be impacted by the changes. So we have some public health nurses that would like to talk a little bit about their experience.
Hi, good afternoon. My name is Natalie Bessie. I'm a court liaison public health nurse in Los Angeles County. Currently, I do not carry a caseload. However, in Los Angeles County, before transferring to this position, I had a caseload of 400 plus. Which is just astronomical. You've heard other numbers where other counties are maybe around the 200 mark. And I know when our program was initially developed, it was supposed to be a caseload of between 180 to 200. So we are at 400 to 500 in some cases. Medically, we manage the health of minors and foster youth, and Los Angeles County has a caseload of about 22 to 24,000 children in foster care, 9,000 of which are on psychotropic medications. So we have a gigantic population in which we serve with bare minimum of staffing. And now that we have SB 319 in addition to our caseload, which we are in full support of, what we are here for is to advocate for additional funding. Specifically we're requesting about $1.6 million, which is a very modest request. It gets about a 75% matching by the federal. This is just the bare minimum that we need to truly start funding our program and be able to actually medically and psychotropically meet the care of these very complex minors in foster care. So again, that is what I'm here for. I'm here to advocate for funding so that we can have additional staffing in order to meet the needs of the children in which we serve. Otherwise, there is a tremendous concern that minors will fall through the cracks. Healthcare problems will go unnoticed, or not that they're unnoticed, but they will be caught maybe very late. And as you've heard a previous PHN speak, we're even concerned that to the degree that, unfortunately, maybe even a fatality could occur. So we are here to advocate for funding. So anything that you can do to help fund this program better, we greatly appreciate. Thank you very much.
Thank you.
My name is Danita Harmon, and I'm a public health nurse for LA County. And I'm just here to reiterate the fact that the reason our program was initiated is because foster children needed more oversight. The social workers were drowning, and so they brought us in to bring our expertise into the table. So we're here, we're in the program to help monitor the foster children in foster care. However, with the SB 319, that's going to be really difficult for us to keep up with that because of our staffing. We have children who are diabetic. We have children that have different complex medical needs. And psychotropic medication monitoring is in itself a complex situation as well. So we want to be able to give both of these issues. We want to give them our full attention. We want to be able to do our best. We know that the children need to be monitored. We're in agreement with that. But we're just needing funding to increase our staffing so that we can adequately monitor and do the job that we have been assigned to do. And so we're asking you guys if you would release that funding for us so that we can increase our staffing and we will be able to take care of these children, both the children that are on the psychotropic medications as well as the regular children that we are allocated for in foster care. Thank you.
Thank you. Next speaker.
Hi. My name is Karen Solomon. I'm from LA County. I'm with SEIU 721 as well as the other public health nurses. And mainly when this Senate Bill 319 first came on board, we all agreed that it's a great policy, but we had the expectation of thinking that they were also going to give us the staffing and the monies to also support this bill. So in order to help the children in foster care, which we work with daily, and as you saw the young ladies earlier speak and the PHN on the table, we have kids anywhere from 2 to 18 years of age, and we also have the AB-12 children who are now staying in foster care, and they're on psychotropic medications. However, we've been mandated to monitor the children who are detained by the court that are in foster care, and without the proper staff, we will not be able to really effectively help these children or these youth the way that they should be helped. So we're just asking for a modest amount of $1.65 million to match the federal of 75%. And that would greatly help us, which we really love our children, and we know that they need so much help. So if you could help us, we would really appreciate it. Thank you.
I just want to say to the next speaker, my apologies. We have to run a schedule here where each of us are expected to present bills in front of other committees, and that is why we keep ducking in and out. I need to leave very shortly. I'm going to turn the podium over to Mr. Harper, but I just want to say with regards to the psychotropic medication issue, my wife works and represents foster care kids, and I've been hearing about this situation for a number of years. It is absolutely something we need to get a better handle on, and as I mentioned earlier, I was happy to work with a number of these bills last year to move this forward, but now we have to figure out some funding to make sure that we as a system are not letting our kids fall through the cracks. So I want to thank both the nurses who are here as well as the young people who have very courageously helped to share your stories. Your voices are so critical to moving on this issue. So next speaker, please.
Sure. And